So today we're going to be talking about tear trough filler, and we are here with Nicole, our med spa manager of our new sister company, Théia. So we're going to run you through some of the risks of tear trough filler and what we like to offer as an alternative. So tear trough filler, what that is filler in the under eye area. And it sounds like a good idea, but that is a very thin area of skin and it has lots of blood vessels and it's a very congested network there. And you really have to be careful if someone is trying to convince you to get filler in this location. So the most common side effects with this, bruising is a big one, just like filler everywhere. You can also get some bleeding in the area, you can get some swelling. And then the biggest one for us would be stroke and vision loss. And while this is exceedingly rare, obviously a major complication that we have to be very careful of. What can happen is that filler, if it migrates into one of those really small vessels around the eyes, it can actually cause an artery occlusion or a vein occlusion, and that can lead to permanent vision loss. If it migrated to a vessel that actually was connected to the brain, it could lead to a stroke. So at this time, we do not offer filler in the tear trough for that specific reason. As an eye care company, just didn't feel right offering an aesthetic solution that could result in such a serious complication. But if something changes, if a new product comes on the market, absolutely is something that we would potentially look into. But Nicole will tell us a little bit more about what we do offer.
Yeah, so we have a couple different treatment options, one being the Morpheus 8, which is a radiofrequent microneedling. And what it does is it penetrates into the skin, it heats up, it causes thermal damage, and then it stimulates your body to produce new collagen. So any crappy skin in that area, any fatty tissue in that area, it can essentially cause damage and your body will essentially excrete it as waste. It breaks it down. And so we can reduce that with a series of 3 treatments and you'll have tighter skin in that area. Another option too would be the CO2 laser. That one has a little more downtime than your Morpheus 8, typically up to 2 weeks. You're causing some little skin marks in a square on the face, and what it does is it essentially is peeling off that top layer of skin and causing your skin to again create new collagen. And so what it does is it can tighten the skin and reduce that under eye bag appearance.
Which is helpful. That skin, because it is so thin in that area, is very prone to wrinkling. So I'm always cautious with patients, when you're washing your face or you're applying any makeup, don't do a lot of dragging and pulling motions, or doing more tapping and gentle, because that skin is just super fragile. So anything that can improve the elastin and the collagen that's going to tighten it is really going to improve the appearance of the eyes without the use or need for fillers.
Yeah, and you can do filler in your cheek area to help reduce the eye bag appearance if a lower cosmetic bluff is not the option.
Yep, and that's a good spot too. A little bit less vascularized, less close proximity to those eye vessels. So the cheek filler is something that we do offer. And again, if we change our mind, something new comes on the market, we will definitely let everyone know. So again, Nicole is from our sister company called Théia. We have a new med spa. She's the manager, and we have been doing lots and lots of new treatments and therapies, and we're excited to tell you about more.